My name is Salam Salloum, and I am a consultant cardiologist. Well, this goes back to when I was a child, and when I watched some uh, videos about live operations, mainly about heart surgeons who are doing heart transplant and how they transform patients' life from being kind of completely disabled, unable to do anything, and then the follow-up appointments they show how the patient has improved, able to gain back or go back to their life completely normal and asymptomatic. So this encouraged me to become a doctor that I can make some positive changes to patients and make them regain and restore the life they lost. Cardiology has a wide range of subspecialties, and I enjoy being more analytic, and I found a good opportunity in cardiology, looking into more details, especially in cardiac imaging, which is my subspecialty, making the diagnosis and suggesting the appropriate management for the patient based on things that I see directly and I have assessed myself, rather than relying on some verbal or even written messages or reports from other colleagues. I still trust my colleagues, but it's good to make your own judgment and make a clinical decision based on your own assessment rather than on someone else. And for me, the subspecialty in cardiac imaging, it is a key thing in patients management because everything is guided by evidence-based. And we have to have evidence of everything. The best evidence is what you can see. The most rewarding about my job, I find when I have a follow-up appointment with a patient and the patient tells me that they have improved significantly since I made some changes to their medications or some to their lifestyle as I recommended in the previous appointment, and they started to gain some of their life. When I have one of the most rewarding thing when I see a dad or a granddad, for example, grandparents or parents coming to me and telling me, now I can enjoy playing with my children and the grandchildren, which I have missed for a long, long time. This is one of the most rewarding thing that I can see. Well, through some feedbacks that I had from patients, they appreciate my kindness, my ability, and the patience in listening to them, addressing their concerns. No matter how many questions they have, I still give them my time to ease them and make sure they have all the questions answered. And when they go for a procedure or a test, they have all the information they needed. Yes, one of the things that patients express that they have confidence and trust in what I tell them and my management, and they are always happy to come back and see me again and again, either in the NHS or in my private practice. And this is evidenced by a number of patients. They always come back to consult me, either about themselves or some relatives. And also they referred other patients to myself directly. I always say I should always treat patients as I would like to treat my family, or as I would like my family to be treated. And I would always put myself in the patient's position. How do I like to receive the treatment? Then that's how I deliver it. I have been a patient in the NHS, and I can see from the other perspective how patients could feel when they meet a doctor or when they receive a treatment. They always appreciate someone to listen to them, someone to give them the care all the time and make them valuable always. The center of attention.